Hello and welcome. You know, artificial intelligence has been adopted in many fields, including manufacturing, medical, financial, and web platforms, just to name a few. But did you ever consider how a trip to the dentist does, and how will artificial intelligence be used there, or AI? Welcome to Celebrate Michigan, the show produced on the campus of Madonna University. I'm Greg Russell, and joining me on this program is Dr. Timothy Kosinski. Dr. Timothy Kosinski, an affiliate adjunct clinical professor at the University of Detroit Mercy, go Titans, their School of Dentistry, who currently serves as the editor of the AGD journals and editor of Dentistry Today Implants. Dr. Kosinski also has received many other honors, including the Academy of Dentistry's International's Humanitarian Award in recognition of significant contributions to the enhancement of the quality of life and the human condition. He's here today to talk about the field of dentistry and perhaps give us a little insight on how AI is being used in dentistry. Welcome to the show.
Thank you, Greg.
Whoa, you've done it all.
Well, not yet, but hopefully we'll keep working on it.
Now, we had mentioned how AI, something brand new. How is that now fitting into dentistry?
You know, it's a great question. Dentistry, I've been doing this a long time, and dentistry has changed so much. It is a great time to be a dentist. It's a great time to be a patient in the dental chair. We are able to do so many things using computer generated and the internet, our technology, our scanning ability, CAD/CAM design, milling in the office, having teeth done while you're sitting in the chair. The newest thing is our x-rays. The AI is going to diagnose and plan where you have cavities, gum disease, and help the dentists to evaluate and make better judgments for the patients prior to ever touching you. It's amazing.
That is great, my goodness. And something you and I were even talking about before we started, but a lot of folks out there still have apprehensions about going to the dentist. They think it's going to hurt, you know, and they're going to be using like a wrench or pliers from their garden or something like that. But even like the last few times I've been going, you don't feel anything. I mean, they numb you up enough and take everything out and boom, you're feeling good.
I've never heard anybody being afraid of the dentist before. That's a new one to me. No, it can be very stressful.
Yeah.
When you don't know.
Right.
And I'm a big believer in educating, instructing, and I think that's a very important relationship. We were mentioning different dentists and things like that. The more you understand, the better the results. And it's important to feel comfortable with whoever's treating you, physician, nurse, a mailman, whatever. It doesn't really matter. Feeling comfortable as we are. We just met not that long ago, and it's important. So, fear of the dentist really isn't necessary, but it's always going to be there because you don't understand and you think it's going to be bad. But you're right. Once you go through the process and you go, oh my gosh, we do a lot of dental implants. Yeah. It used to be a 2.5-hour procedure. It may be a 15-minute procedure now where patients go, wow. Or taking a tooth out and people go, get out, you're done? You know, those dentists that used to put the knee on the chest to take teeth out?
Yes.
That person travels around the country a lot, but it doesn't have to be that way anymore. And I encourage people to find the right person, but also to realize that technology has improved so much that, as you said, it really isn't hard. It's not a hard procedure anymore.
No, absolutely. Like I said, the last few times when I had to have something extracted, like you said, you sit down and you're going, okay, you're done? It's like, yep, just spit and you're all set.
That's right. That's right. That's right.
I also have to ask, how has dentistry changed since COVID came about?
Yeah, COVID was a rough time mostly because we didn't understand, and we still don't understand a lot of things. But I know it closed our practice here in Michigan for basically 2 months, other than emergencies. We made a huge investment in air cleaners and UV lights and the shields that everybody has, and trying to find gloves and masks and things like that. But dentistry was always really good with that patient care. We were always wearing masks. We were always wearing gloves, or for the last 30 years or so. So we always protected our patients really well, and we protected ourselves very well. We've always sterilized our rooms really well. So it's not like the general public, taxis and buses or airplanes. It was different because we always did a really good job with that. But we had to make a big investment. Unfortunately, COVID stopped people from coming to the dentist, stopped them from seeing the hygienist because of the fear of contracting something that we didn't understand. It's dissipated. Obviously, it's been a couple years now, and I think that fear factor is gone. We don't see a lot of masks anymore. We always wear masks, and we continue to sterilize, and we let our patients know how important it is. The things that we do to protect them, how important that is.
Right, I can understand. Also, what was it that made you want to go into dentistry?
Wow, that's a great question. Greg, I don't know. To be honest with you, I've asked this a lot of times. I was going to be a professor. I was in the PhD program. I was going to be a biochemist at Wayne State's Medical School.
Right.
And that was probably the hardest year of school I ever had. And my faculty person at that time, we were having a beer, and he says, "Tim, you're a smart guy. You have other things that you can do." My dad was a carpenter. Okay. And dentistry is really carpentry. You were saying about the tools. Yeah, we do wrenches and stuff like that. They're just smaller and a little bit more expensive to purchase. But it was something that I was led into, applied. I don't know why I applied, got accepted, and it was my forte. It was something that I really enjoy. It's not a job for me. It's something that I love doing every day. I have a great team. They make my life pretty easy.
Great. I say, and that is important. Doing something that you enjoy doing. Yeah. There's nothing worse than having a job and you're going, I don't want to get up in the morning.
Oh boy, dentistry is a hard job, a great profession. For those young people out there interested in developing a profession, dentistry, I think, is absolutely the greatest profession out there. You're a business owner. My kids grew up, I never missed their sporting things. You have a lot of, you're respected in the community, and you're able to really provide a really nice service to our patients.
Well, can't wait to talk more about dentistry with you. We're going to take a quick break, and when we return, we're going to, how you like this, dive deeper into AI, artificial intelligence, and dentistry. So stay tuned.
Super.
I got them all.
What to expect when you're expecting
Like here.
a teenager.
Today, I'm going to show you how to teen-proof your home. First step, hide the car keys. Preferably somewhere they would never look. Challenges will come up. Be ready for them. Hi, honey.
Ready for the... Mom, you don't use mannequins in the mannequin challenge.
You don't have to know it all to be a perfect parent. Thousands of teens in foster care will love you just the same.
Do you like this top? It's so gay.
Really?
Yeah, it's totally gay.
You really shouldn't say that.
Say what?
Well, say that something's gay when you mean it's bad. It's insulting. What if every time something was bad, everybody said, "Oh, that's so girl wearing a skirt as a top"?
Oh, you are.
Those are cute jeans, though. When you say that's so gay, do you realize what you say? Knock it off.
Welcome home, man.
Hey, you.
Yeah, you. Getting that college education. What are you gonna do? Graduate and take some office job? Be like everybody else?
Or will you dare do something different?
Like, be a teacher. You could be my teacher. You got the skills.
The smarts?
Yes, you.
You could be the teacher I never forget.
That'd be cool.
Does that corporate job even have recess? What are you gonna make of yourself?
What are you gonna make of me?
Welcome back to Celebrate Michigan. I'm Greg Russell, and today I'm talking with Dr. Timothy Kosinski about new advances in dentistry. And we've just been having a great time talking about all this new stuff and all this fabulous things that you guys are doing. But I have to ask you, you did bring a video with you. Explain it to us right now, what we're about to see.
So Greg, you know, when you don't understand, let's say you're missing a tooth, or you have a bad tooth and it hurts. And as we talked about in the first segment, you know, it hurts, but we're able to remove a tooth. I like to call it atraumatically, you know, where, wow, you know, it doesn't have to be a hard thing. I know the shots aren't pleasant, but we get over that. We do a lot of sedation dentistry. We work a lot with physically and mentally challenged. But once we take the tooth out, we can actually grow bone today. We can physically grow bone. And what I do a lot of are what's called dental implants. And dental implants are just simply pieces of metal made of titanium that are embedded in the jawbone that simulate a tooth. It allows us to anchor something to it. It could be one tooth, several teeth, all your teeth, dentures, partials, whatever, similar to what orthopedics use on knees and hips. I had my knee done about 3 years ago. And it's
and
great.
You're walking around great.
And what we're able to do is we're able to, by doing our three-dimensional CBCT analysis, CAT scan analysis in our dental office, we can actually virtually design not only the placement of the implant, we can design the final teeth before we ever touch you. I can show you all that beforehand. So it's just amazing how far technology, I like to tell my students that I have a lot of experience, but with modern technology, we're all equals. We can diagnose and plan accordingly. So the video shows how we can morph from an x-ray to actually virtually placing an implant and virtually placing a tooth to the final product, which will be exactly the right position.
Jeez.
No error. We're taking all the error out of it through computer imaging.
Right, wow. Now, we just saw the video. Also, you have some pictures of clients that are pretty dramatic, you know, to look at. Take a look at these and tell us what we are seeing.
Well, you know, a lot of our patients come in with serious problems, aesthetic problems, gum disease. They're losing their teeth. And oftentimes we need to remove all their teeth. But people today want permanent teeth if possible. And to do that, again, we can virtually design it. We have help where we have software, manipulating software where we can place implants, we can design the teeth. I can show you what it's going to look like before we ever touch you. We do guided surgery. It makes things fast, simple, and predictable. And it takes a lot of the human error out of it. So using artificial intelligence, we're able to give back people their smile, their health, improve their quality of life dramatically. Biting into an apple, feeling comfortable, laughing, kissing, feeling confident. Again, improving the quality of life is so important, and it exists, and it doesn't have to be overly expensive either. That's what's nice, because with technology, the costs have come down. And our abilities, the time that I spend doing a procedure has come down. So it's really exciting time to be a dentist, Greg.
And I just have to follow you up with this. Like you and I talked about before, you know, I had a tooth that was knocked out, and it was kind of weak to start with. Once I got replaced, like you said, it is nothing better than sitting down with a nice juicy hamburger or something where you just bite right into it, and you don't have this fear of, you know, something happening.
Fear. We have to get over that, and you know, I strongly recommend that you know, educate, instruct. Come in and find out what's available. Well, you don't have to do anything. You're in complete control. But if you don't know what exists, you can't move forward. And our dentists are very talented. You know, our education at our alma mater, University of Detroit, is second to none. Those students come out primo. They really have a strong understanding of not only the technical skills and the technology, but management of our patients. And I'm very proud of our university.
There you go. There you go.
And our city.
All right. Now, we have another case we want to take a look at. Take us through these pictures as well.
Again, a friend who became a friend, who had a lot of problems. He's not a young man. He's lived like that his whole life. It was time for him to evolve and improve his smile. But he had a lot of health issues. We're on medication because the teeth are the gateway to the rest of the body. And we're able to design and see everything in 3 dimensions today. 3 dimensions.
Wow.
And we're using facial recognition to help people design their faces again. When we lose teeth, we're collapsing, our noses get longer, our chin gets wider. it's just going so darn fast. And it's, again, a great time to be a dentist and a great time to be a patient. But we can actually place everything and just amazingly change somebody's life. Feel better, confident, and moving on with a happy, fruitful rest of their life.
Right.
With health.
Yes. Because like I said, there is nothing better than to just go up to somebody and
That's right.
Smile.
First thing you see, eyes and teeth. So it's important that people understand what we're able to accomplish.
Yeah, and like you said, so much has changed over the years. It's no longer like if you had to get all your teeth taken out, you'd get these big horse like dentures in some cases where you could just look at the person and tell. Now, it looks like what you were born with. You know what I mean?
Greg, what we're doing now, we're taking it to the point where you can come in. We take our three-dimensional. We virtually design everything. We can make the teeth before I even take any teeth out. We can give you permanent teeth. We can give you removable teeth in one sitting oftentimes. That's how fast the technology is developed.
And that is amazing, again, because like you said, I think in a lot of people's mind, it's like, it's going to take months and months and months or whatever, to get it, where now it's like, hey.
And it can take months. Every situation's different. We take our time. I like to say it's the end result that matters the most.
That's right.
All the steps you'll forget, but it's art. It's sculpting. Dental implants is an amazing part. When I started, it was considered to be experimental. It's commonplace today.
Oh, that's for sure. You know what? We have to take a break. We want you to stay tuned. We'll be back talking more about AI and dentistry with Dr. Kosinski.
Awesome.
Loving it.
So we were walking to school.
I started thinking about lunch. Mom packed me turkey and cheese.
She's
I really want
smart.
cheese pizza.
Sometimes her mind wanders.
We should have a sleepover.
I remember saying, Laura?
I think I heard Mom say something.
The sign says don't walk.
Sometimes it's so overwhelming.
I really hope she doesn't
I
have
really
another
hope I
bad
don't
day
have
at
another
school
bad day at
today.
school today.
When you can see learning and attention issues from their side, you can be on their side. Go to understood.org, a free online resource with support and tools to help your child thrive.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
Fast-paced family life in need of a slowdown?
Hello, I'm Dr. Spruce. Did you know all those green shapes on maps are parks and forests? It's true. Visit discovertheforest.org and plan to visit a park or forest near you, instead of just wondering what it would have been like.
While the word forest might make you think of distant lands from far, far away, please note parks and forests are closer than you think, which means things like beautiful scenery, fresh air, and family time are also closer than you think.
Open road, here comes the Heffley family.
Whether it's a short trip or a long haul.
Estimated time, 47 hours.
They will beg.
You're hungry? I'm happy to provide.
They will plead.
Deep fried butter on a stick.
But whatever you do, don't wimp out.
Now you're talking.
Make them buckle up.
He can't hurt.
Remember, safety first. Cheese curls, second.
Are you orange?
And welcome back to Celebrate Michigan. I'm Greg Russell, and today I'm talking with Dr. Timothy Kosinski about new advances in dentistry. Now, the last two segments, you and I have been talking about artificial intelligence and, just how that's coming in, taking over, which is, great. Now, over the span of your career, could you imagine, like when you first started, the leaps and bounds you'd be at right now?
Wow. Yeah. No, obviously no. And you don't realize, it's like cell phones. We didn't have phones. It was on a wall, right?
Right.
And everything is so dramatically changing. When I started, we wore white coats and a tie. We went through a lot of bad ties, a lot of splatters on ties. We didn't wear gloves. We didn't wear masks. It was different. Our equipment was archaic compared to what we use today. The materials, we would put goop in the mouth, and now we use a computer to scan. That information is sent to our laboratory in California, and we get the results quickly. Or we can actually mill in our office. We can actually make teeth while you're sitting there.
Wow.
Not everybody wants to do that, but it can be done. We're printing now. We're printing teeth with printers. It's just, it's mind-boggling how fast and how effective we are. Our anesthetics have changed. Our medications have changed. Our equipment has changed. Our x-rays have changed. We talked about the three-dimensional x-rays, the CAT scans. We see things in 3 dimensions that we could never see before. We see overall health. We see the throat, snoring. We can diagnose that as dentists.
Oh, wow.
We can see how the airway is closed down, the sinuses, things like that. So we truly are physicians of the mouth.
Yeah.
And we constantly are working with our physician colleagues because they're interested in what we do, and we're interested in what they do. And there's not such a separation anymore. So yeah, the changes are so incredible. The visual acuity we have with loops, we see things that we never saw before. Believe me, it's amazing. And then the newest thing are we have artificial intelligence that will diagnose our X-rays. It'll show you where your cavities are, how deep they are. I'm a very conservative dentist. I don't want to drill in your teeth if we can grow enamel back, and we can, or gum disease and how we treat it. We still need competence in the dentist. We still need the human touch.
Right.
But artificial intelligence is a tool that is making us so proficient and efficient, which saves money, right? We can see more patients. We can diagnose better. We're not missing things. And that's important. You said earlier, friends that haven't been to the physician. Why? Because they're afraid they're going to find something.
Right.
Well, if I find it early, I can fix it easily. If I find it late, it's expensive, and then you have fear. So we can eliminate that. So see your dentist. It's important.
There you go. And I agree with you. Be preventative. Go and get things checked out first. Because like you said, you can easily just go, oh, you got a little dot here. We can fix that. Everything's good. But you let it go for 5, 6 years.
It'll be gone.
Not so good. Not so good.
Yeah.
Now, you are not only an implant expert, but you've taught many other doctors this procedure. Now, how did you become interested in the art of dentistry, and then also talk about the implants as well?
Yeah, implants always made a lot of sense to me, Greg. Even during my residency, our modern implants were introduced to the United States in 1982. I've been doing it since 1984. So I've been doing it since its inception. And there's been a lot of changes, a lot of good things. I mentioned that I really wanted to be a professor, a PhD. So teaching is always in my blood. So even when I got back from my residency, I started teaching at our dental school, at Detroit Dental School, part-time. And continued to develop my skills, and now I lecture all around the country. I'm actually gone 27 weekends this year. I was blessed with great mentors in my career, people that really helped me, and it's really rewarding at this time, at this stage, to be able to give back to the profession, because you have to share this knowledge. It can't go away. And that just elevates the whole profession to a higher level. And I'm excited. It's really, I'm very balanced and very rewarded.
That's great. That is great. And you made me think, before COVID, I used to travel pretty much every weekend. We probably were on the same plane. One time or another, I wouldn't doubt. So, but the next time I'll be looking for you.
There you go.
Fabulous.
There you go. Hard to miss.
Now, why are these advances so important to the doctors and to the patients?
Well, number one, for the patients, it makes things easier, faster, better. More precise. The doctors have to make, and it's very important, the doctors have to make a significant investment. This technology is expensive, and the patients have to appreciate that. It's not, you get what you pay for sometimes. So be aware of that, okay? Same with medicine, and it's important. But the technology has just shortened our chair time, allowed the patients to be more comfortable and to get a more predictable result, which is important. You want a great smile. If you're spending money, you want something that not only is functional, you want to be able to bite into an apple, have that hamburger, corn on the cob, and enjoying life. And also your overall health. If you're not eating properly, if you're not getting the proper fiber, nutrition, it's affecting your body. And you go to the physician, you're worn down, you're tired. It could be something going on with your mouth. Diabetes, your sugar level, could be something going on in your mouth. High blood pressure, could be something going on in your mouth. So alleviating those problems, I always tell my patients, go back to the physician, have the blood tests again, because things are going to change. And maybe you're not going to need as many medications for your overall health.
Nope, that's for sure. And to learn more about Dr. Kosinski and his team, you can find them on the web. Just go to smilecreator.net.
Yep, that's
there
it.
You go.
Smilecreator.net.
Hot dog.
Yeah.
And I got to tell you, it's been so much fun talking with you today. Learned so much. And again, don't forget, folks, your dental health is very important to all of your health.
Critical.
So that's all we have time for today. I'd like to thank you again, Dr. Timothy Kosinski, for joining us today. I've enjoyed our conversation, and I'm just going to give you a big smile.
Perfect. I love that smile. It's an awesome smile.
Thank you. Take care, folks.
Thank you so
Thank
much.
you.
You're awesome.
Oh,
You're
you
awesome.
too.
That's awesome.